Hello again. Now, the Rural Health Advocacy Project is concerned about the impact that the public sector strike is having on healthcare services. The group is calling for parties to promise in writing that the rights of patients in rural South Africa will be protected. The group's director, Russel Rensburg, says their mission is to promote, protect and advance the right to health care of rural communities. He joins us now live to discuss this, of course, talking to him virtually. Good afternoon, Russel. Welcome to today here on eNCA. Thank you very much for your time. So what is the major concern in terms of yourselves by the public sector wage dispute that seems to be ongoing? And although the government has implemented a 3% increase, trade unions want more. And just yesterday we had that national 1 day of action, and we're expecting more. So what's the real concern for you?
I think let's start off and say that we recognize the right of workers to strike, right? And similarly, we also, as you so rightly indicated, our mission is to promote and protect and advance the right to health of rural communities, right? I think in the absence of any kind of agreement that ensures access to essential services, there is a real risk that the contestation between these two rights will result in rural communities and communities in general not being able to access essential healthcare services. So our concern is that health services will be disrupted, and some of the losses that we've gained that happened during COVID around TB, HIV, maternal and child health will get worse when we should actually be sitting around strengthening it.
Yeah, the understanding is that rural communities depend largely on public service.
That's correct, yes. Yeah, rural communities are among some of the poorest. You know, there's very little medical aid coverage. I think it's probably lower than in the rest of the country. And 90% of high unemployment, it means that people are completely reliant on publicly funded services.
So you are concerned that a protracted strike, if it happens as ongoing labor dispute, will also affect access to such services because they will not be available.
That's correct, and I think part of asking for a minimum service level agreement to be negotiated by the parties is to ensure that we can still have access to emergency medical services, is to ensure that, trauma and emergency services are still available within hospitals, that we can ensure that clinics still are able to offer the basic healthcare services, like people collecting their treatment, like mothers visiting for their antenatal visits, for children to get their vaccinations, and for the strike to be conducted in a manner that is respectful of the right to health of patients.
Yeah, has it happened before that there was such an undertaking in writing between the parties involved?
Well, I think part of why we're resurfacing the conversation is that we were involved in 2011 in discussions between organized labor and the Minister of Health and with some legal opinion from our partner, Section 27, on how globally this is handled. And I think at the time, the Minister was sort of very insistent that healthcare workers are essential workers and they are not allowed to strike. But that hasn't stopped strikes from happening. We know what happened in the Northwest recently and in other times, and how healthcare services are disrupted. And I think now we have an opportunity with new leadership and a new reality for the parties to actually come together again and have a discussion of how can they implement this kind of measure to ensure that healthcare services aren't disrupted.
Yeah, so you as the Advocacy Project, are you going to be knocking on some doors to spare, besides having conversations with us in the media, are you going to knock on some doors to spare them on towards this goal that you are intending to achieve?
I mean, that's how advocacy works. We are knocking on doors. But the statement was really just to make a broader public appeal to the parties involved in the strike. We recognize that the conditions of workers in the public sector can be challenging at times, and we do owe them a great debt for the services that were delivered during COVID under very difficult times. But we also feel that right now, the parties need to find each other. And part of our advocacy attempts is knocking on doors, coming onto the media, issuing the statement, and hoping that these negotiations, should they progress, can actually consider the right to health of patients while at the same time settling the dispute.
Yeah, as far as we heard yesterday from some of the trade union officials, there are no negotiations happening currently. There are no discussions happening currently, but let's hope that they will resume, because government's position is doesn't have the money to offer more than 3% of a wage increase, and the unions are demanding something around the inflation number, which, as we heard today, Russell, has now increased again. So we have higher inflation as of today. Where are the rural communities in South Africa? Where are the areas where the need is most acute? Are you able to share that with us?
Look, I think the health system trust, did a review from 2000 to 2015 on what they call a UHC index. And what they look at is probably like access to like routine healthcare services, like sexual and reproductive health services, responses to infectious diseases, maternal and child health, and NCDs. And they compiled sort of like an index. And on a whole, our country is probably sitting at around 58% in terms of achieving that. But when we look at the more rural districts, we probably make up the majority of the public funded system. And about 40 of the 52 can be considered rural. They were performing a lot worse on a lot of those indicators. So where the country is sitting at 58% on some indicators, rural districts set at 40%. So most rural districts, but particularly those in former homelands, really have, how can I put it, less enjoyment of the right to health. And there could be a number of different reasons that informs that. But I think we have to design a system that responds to meeting those priority concerns, because we won't have population health if we don't improve rural health.
Yeah, how confident are you that your appeal will land on fertile ears, and that as these parties in the public sector are busy negotiating the way forward beyond this year, they will take what you are concerned about into consideration and commit in writing to protect the rights of patients in rural South Africa?
Well, I'm confident that the leadership in all of these sectors have the interests of the public at heart, right? And I feel that they can, when they consider their negotiations and how they find them, and if you just look at how this particular strike is being conducted so far, is already a sign of hope. So in the past we would have had very aggressive strike action, and I think the approach taken by the unions at this point has to be much more measured. So have a national day of action and then go back to work. Some of the calls was that they would stop paying their rates and so forth and etc. So I think the language and the approach is very different, and that's already hopeful. I think we have a new health minister who is a lot more appreciative of some of the challenges that we face, and that we're willing to open for negotiations. And I think then there's the election coming in 2024, which is making all parties a little bit more considerate. So I'm very hopeful that we can take this conversation forward, and that the public sector, the parties to the strike or to the labor dispute, can find it somewhere in the middle, where we are able to progressively start addressing everybody's claims. But I think the most important thing for all of us to consider now is, how do we strengthen social solidarity? How do we put the interests of healthcare users at the center of any kind of health system strengthening? And how do we start building a story that includes everybody and move away from the current contestation that we have? And that's my hope, but I think we will continue working progressively and working with partners to make sure that we can all come to some kind of agreement. But at the moment, I don't think that we should put the public's interests aside, and we should put that at the center of everything that we do.